So welcome everybody. I know there's a few people still coming in the room here at the moment, but thank you for joining us at today's academic symposium and the launch of the Centre for Sex and Gender Equity in Health and Medicine. For those of you who don't know me, I'm Robyn Norton. I'm the founding director of the George Institute for Global Health, Professor of Public Health at University of New South Wales, and I've had the privilege of chairing the interim steering committee for the new centre. I also have the pleasure of overseeing this morning's session. Before we formally start today's proceedings, some housekeeping. If you haven't already found them, the bathrooms are down the stairs to the right and round the corner, and we were looking at fire exits. You can actually get out through those doors there. Otherwise it's heading downstairs and out the buildings in case there happens to be a fire. The event today is being recorded, filmed, so please be aware of this as you move around the room. This room is also connected with a hearing loop, and there is a live closed captioning on the screen in front of the stage. It is now my pleasure to invite Auntie Lola Ryan to deliver the Welcome to Country. Welcome.
Nagabi Nagan, Anilola, Nai Doral Gully, La Perouse, Nai Naranang, Nalamanang, Bidigal, Nai Gammaringai, Doral Langa. Welcome, my name is Anilola, and I'm a Doral elder, and I'm from the La Perouse Aboriginal community, and we are on the northern side of Botany Bay. I acknowledge we are gathered on the land of the Bidigal, and I introduce myself in our Doral language. This isn't my profession. I work as an Aboriginal health worker for the Child and Family Health team for CESLID, a position I've held for 20 years. Hopefully I'm retiring this year. I feel like I have worked for 50 years. I've worked since I was 15 years old, so just gave away my age. And I think it's time for my grandkids to have a part of me instead of all the other community children, but I will be working closely with our Gujaga Foundation, who work with all of our children when I retire. So just do volunteer stuff, just to keep the mind active. That's what I like to do. I'd like to pay my respects to elders past, present and emerging, and extend that respect to all of you present here today. It really is a pleasure to be here to welcome you to the Centre for Sex and Gender Equity in Health and Medicine. And I'm so excited that all this is happening for our LGBTQI community, that everybody's equal as far as I'm concerned. I don't care what your gender or your sex preferences or your race are. But you know, working in health, we work with everybody. I work with so many people, and when I was 15 years old, my first job was I used to make cassette tapes, the place where I worked, and there were so many different cultures, and once every couple of months, the boss, Jewish people run a family, and they allowed us to bring in something from our culture and our background to share as a lunch. So every couple of months, we had, food from all different countries, many Spanish and Italian people and that I worked with. There was about probably 7 or 8 different backgrounds. So, and some of them I still see today. We are long-time friends. And I thought that was very special, being an Aboriginal girl born on an Aboriginal reserve, and to have that was really great, because I'd never tasted any kind of food from other countries, and it was amazing. Some I liked, some I didn't, yeah. I won't tell you which ones I didn't. So our Welcome to Country was traditionally done through song, dance and music. Today we welcome you in a contemporary way and ask that you respect the land, the culture and our traditions. We always thank our ancestors for taking care of our land, our oceans and our waterways, as they only took what they needed to survive. That way, no families went hungry. Our people walked the land from the Sydney Harbour to the Shoalhaven region, which is, you know, if you drove, it's around 3 hours. So they did that seasonally, and that was to sustain the wildlife and the vegetation, hence how we survived for over 65,000 years. And why we live in such a beautiful country. I think our country is amazing. I've travelled a little, but you know, love to come home. So sharing our traditional cultural knowledge and restoring our language allows us to leave a long-lasting legacy for our future generations. It also enhances that Australia has a strong Aboriginal culture. So on behalf of my ancestors and my community, I wish you all a very warm welcome. We are spiritual people. We believe our ancestors walk with us. May their spirits be with you. Keep you safe on your journeys wherever they may take you. Budjuri Nandawabi. That means thank you and have a great day. Thank you.
Many thanks, Auntie Lola. It's really lovely to hear your story. So, and thank you for being with us today. And I know you're going to join us tomorrow morning as well, so appreciate your engagement. I'd like to begin my opening remarks by acknowledging the traditional custodians of the land on which I'm meeting today, the Bedegal people, and pay my respects to elders past, present and emerging. I'd also like to welcome any Aboriginal Torres Strait Islander people who have joined us today. I'm really thrilled to welcome you all to the University of New South Wales, Sydney, for today's academic symposium on sex and gender in health and medicine, which of course precedes the formal launch of the National Centre for Sex and Gender Equity in Health and Medicine tomorrow. I'd especially like to welcome those who have travelled interstate and internationally. Thank you for joining us. Now, these 2 days are the culmination of many people working for months and indeed years to improve health outcomes and health equity for people across Australia and internationally, through a greater understanding of the roles that sex and gender and other intersectional factors play in health and medicine. For the past 20 years or more, several of us have been undertaking research identifying and addressing sex and gender differences in a range of health areas. More recently, we've been working to encourage the implementation of policies across the health and medical research sector to ensure the appropriate representation of diverse populations in research and the disaggregation of data by sex and gender. And more recently, over the past year, probably even longer than that, a team of us have been developing plans for the establishment of a national centre whose vision is to ensure that sex and gender are routinely considered in health and medical research, policy and practice, with a view to improving health outcomes and reducing health inequities for all Australians. So these next 2 days are the beginning of what we hope will become a nationally and internationally respected centre that not only increases knowledge, but also makes a real difference in people's lives. We hope that you'll all join us in the next stage of this journey. This morning's symposium has a threefold purpose. Firstly, to place our plans for the centre in the context of emerging international trends in sex and gender science. Secondly, to share with you the work and findings of the Sex and Gender Policies in Health and Medical Research project, which has provided much of the impetus for and indeed is the major sponsor for this symposium and tomorrow's launch. And lastly, and importantly, to showcase the breadth and diversity of activity that is already being undertaken across Australia to better understand and address the roles of sex and gender and other intersectional factors in health and medicine. So it is my great pleasure now to introduce Dr. Cara Tannenbaum. Cara is a professor of medicine at the University of Montreal in Canada and an internationally recognised researcher, geriatrician and women's health specialist. She served as the scientific director of the Institute of Gender and Health at the Canadian Institutes of Health Research from 2015 to 2022. In this capacity, she was responsible for implementing Canada's sex and gender-based analysis policy across health research, education, policy and practice. She launched Canada's National Women's Health Initiative, advanced boys and men's health research, piloted the LGBTQI2S community-led research initiative through an intersectional lens, and rolled out Canada's first Indigenous gender and wellness initiative. Cara is someone who I've long admired, and it's been a pleasure to meet in person. And so it is a real pleasure to have Cara joining us today to share her expertise and experience, which, as you see, is across a huge spectrum of work. Please note that there will be an opportunity for audience questions at the end of Cara's presentation. So please hold off questions until then, and I'm sure Cara will lead that question and answer time. So Cara, welcome. It's fantastic to have you here and look forward to your presentation. Thank you.
Hello, everybody. This is very, very, very exciting. I think that everyone in the room is probably an expert here to some capacity on sex and gender already. So what I've been asked to speak about is emerging international trends in sex and gender science. And what I'd like to do over the next 45 minutes or so is really to invite you in to reflect with me on conceptual trends in the field of sex and gender science, and you'll see I'm already using the term sex and gender science, new methods in sex and gender science, and how sex and gender science can be applied through an intersectional lens to achieve social justice. Does that sound good, or do you want me to change the talk? Yeah, okay. Now, I'm going to assume that if you're in this room, then you already know how to distinguish between sex and gender, and that most of you are familiar with the term intersectionality. Would that be correct? All right. But just to make sure that we're on the same page, because I don't want anyone feeling when we get to the question period that there's any right or wrong questions. You could absolutely ask me anything. This is a safe space, no judgment. That when I say sex, I will be referring to the biological attributes of humans and animals, including physical features, chromosomes, gene expression, hormones, and anatomy. And when I say gender, I'm going to be referring to the socially constructed rules, behaviors, expressions, and identities of girls, women, boys, men, and gender diverse people, although in Canada we're starting to use the term gender expansive people instead of saying people are different, saying that we're just expanding the new norm. So I might have to change that slide because that is a new international trend that I just heard about. Now, when I say intersectionality, some of you may not be as familiar with this term, so I'm going to go into a little bit more depth when we get to the methods section. But intersectionality is a concept that recognizes that social relationships of power and marginalization are dynamic and overlapping. And here I have sort of an image that I like about intersecting power relations because of personal traits, although of course this applies to systems and political and healthcare systems as well, and we'll talk about that. What's really important that I learned is not to say the term intersectionality without acknowledging its origins. So this was a term that was coined in 1989 by Kimberly Crenshaw, a Black feminist legal scholar. Although I will also acknowledge that the concept was theorized and put into practice by Black women's grassroots organizers and Indigenous people long before 1989 as they struggled against systems of marginalization and oppression. So, any basic scientists in the room? Good, okay, great. Is there a role for intersectionality in basic science? What do you think? Well, it kind of says it on the slide. People kind of think, oh, intersectionality is just when you take more than one variable into consideration. The answer is no. Intersectionality is about power and marginalization and discrimination. Now, we could have a whole other discussion about whether maybe the animals that you're doing your experiments on feel that there's a power differential. And actually, I will talk about that in a later slide. But the only time you're ever going to use the term intersectionality is if maybe you're talking about EDI and bringing different perspectives into your lab, but you are not going to refer to it when you're writing up your paper. So that's really important because we don't want to misuse terms either. So where did the term originate from? It actually, and this is super cool, I think, originated from when Kimberly Crenshaw, who was defending a discrimination, 3 different discrimination cases, made the analogy of being at the intersection of a traffic accident. And she said that if all the cars were out to get women, then a black woman would be hit. And if all the cars were out to hit black, I know this is a terrible analogy, and I'm sorry, I'm just gonna acknowledge that it's like really a bad example, but this is actually what she presented in court. If all black people were out to be easier hit by cars, then black women would also get hit. Now imagine a black woman at the intersection being hit by the 2 different cars would lead to more severe injuries than just adding up the injuries that would have occurred if she was hit because of discrimination against women or hit because of discrimination against black people. So that's actually where the term, did anyone know that? I thought that was really cool when I learned about that. So it really comes from the intersection of injury. Now, here again, so there has to be kind of a power differential. Power dynamics are at the core of intersectionality, and that power dynamic could be at the individual identity level, or it could be at the society level. But at the end of the day, intersectionality is about the folks who have power, and that influences the decisions that are made and who benefits from them and who does not benefit from them. So we will be talking about intersectionality in terms of power. But this talk was about new and emerging trends, so let me start with that. What's new in sex and gender science? Who here knows the journal Cell? Have you ever heard of that? That's kind of like the big journal in basic science research. Who here was aware that not even 2 weeks ago, they published and dedicated an entire issue of Cell to sex and gender? So imagine that. I mean, we're talking about new and emerging trends. You could tell from just the picture on the cover that already we're moving on to sex and gender. Did you say 101 here in university? Yeah, so we're probably going on to 201 or 301 in this issue. Cell Press was one of the first publishers to give instructions to authors about not being allowed to publish if they didn't report the sex of their cells. So they've always been a little bit ahead of the game. But what they're saying now, and what is if you've had a chance to read the issue, and if you haven't, I really recommend it. It's very, very, it's not just basic science at all. It's about gender. Highly recommend it. They're sort of interrogating this idea of the binary categorization of sex and gender. They're saying already it's outdated, and we really encourage researchers to deconstruct sex and gender into the relevant and precise characteristics and traits at issue in their research. So this is much richer and much more complex than sex differences research. Now you might ask where this is coming from, and is there anyone here from the US? Okay, well, it's coming from the US. Absolutely. So part of this was the, I would say almost problems that emerged with the NIH's sex as a biological variable policy, where suddenly everyone heard that you want us to be doing sex differences research. That's what we have to do now. That wasn't actually the intent of the research. The goal wasn't sex differences research. The goal was to account for sex and gender and their precise characteristics when you did research. So the rush to report sex differences has been noted as a potential problem right now. And I know that I know Mark Woodward, who's gonna be here, this afternoon. I didn't see you, not here this morning, but is going to be talking a little bit more about this. So what kind of issues have emerged? Well, first of all, you can't just do the same research that you were doing and, you know, have two categories. Okay, now I'm going to throw in some female cells and just continue the same experiments and then look at the two groups and say, oh, look, there's a sex difference. Research is about having a hypothesis. It's about there being kind of a substantive reason about the problem that you're trying to solve. So telling people just, oh yeah, just keep on doing what you're doing. Don't worry about it. Just, you know, throw in some females and then report it. That is not what we're looking for at all. Also, what they go through in Cell is that sex itself is not a causal mechanism. It's not due to sex, for instance, that, I don't know, there's more autoimmune disease. It's due to either a protein or overreaction of the immune system. Like, what's the actual mechanism? So reporting sex as a causal mechanism is really not doing justice to the underlying mechanisms if you don't operationalize it. Also, if you do divide your sample and then you say, oh, look, the females are different from the males, there must be a sex difference. Well, was your study powered to actually look at sex differences? And I know we're going to be talking a little bit about statistics. And so people are over-reporting sex differences when the research wasn't designed to do so. And then, of course, in basic science, are the sex differences that are reported in fruit flies or animals, are they conserved or clinically relevant in humans? So when does a sex difference become clinically relevant, and are we barking down the wrong path? So these are the problems that emerged. Now, that being said, there is a lot of work to do because look at this graph. I mean, this is basically a plot of differences in prevalence of many conditions and diseases around the world where there are significant differences between the different, I would say, reporting and surveillance structures between men and women. So what is causing those? I mean, when you think about it, these are huge differences and nobody knows why, and we still have a one-size-fits-all approach to most conditions that affect men and women. So our understanding does need to be advanced. Including males and females is still, I would say, necessary, but maybe insufficient criteria for doing good research in sex and gender science. In Canada, some of you may be familiar with the work of Jeff Mogul, who's one of our basic science, who decided to actually look at mechanisms of chronic pain. And I know, for instance, in the state of Victoria, I think there's a whole women's health initiative launched, and they're looking at addressing pain for women because this is very underreported right now. So, you look and you will find completely different cells, T cells in female mice and microglial cells in male mice that have molecular pathways that are different. And could this lead to new treatments? Could this lead to new understandings? Absolutely. But his research was specifically designed to look for this. And then we want to be looking at mechanisms. That's another trend, like I said. So mechanisms are what? Is it due to the sex chromosomes? Why do men die earlier on average than women? It could be due to a lot of different things, but there is a mosaic loss of the Y chromosome that's been observed in blood cells with age. Has anyone ever really looked at that? Or even the autosomes. We know that 85 to 90% of genes exhibiting sex bias in humans are from the autosome. So 23andMe, right? You've got your one pair of sex chromosomes and then your other autosomal chromosomes. Stuff is happening there. In fact, we now know that 15 to 25% of genes escape in X inactivation. And I think many of you are familiar, but maybe not, with X inactivation. So, in female cells, you'll get XX. In male cells, you'll get XY. In intersex or other combinations, you might have XYY or XXY. And so when there's two X's, one of them will get silenced, leading to a gene dose imbalance. And as I'll show you in a video, this could be really, really interesting. So, or is it the sex hormones? Or is it epigenetics? We know that sperm microglial microRNAs transmit intergenerational epigenetic information. So is it actually the environment, because of gendered and societal factors, that are working on the genes that then lead to some of this? I mean, these are amazing questions. Now, some of you may not be aware that proteins, we found out, at the protein level, their stoichiometry, so their 3D structure and the abundance of certain proteins are different. And then glycans. Do you know what glycans are? Glycans are the sugars that coat the different cells and the different proteins. So if you have antibodies, you've actually got these sugar molecules attached, which make it so that an antibody recognizes, I don't know, coronavirus or not. And we now know that the branching patterns of these sugars are actually different based on sex and age, but no one's looked at this before. So if you look, you definitely will find. And the trend, I think, is therefore moving internationally from, yeah, males are the default, one-size-fits-all model in research and healthcare, to, oh no, we need to look at sex differences research and this idea of a binary categorization, to more mechanism-based research that addresses the need to account for the variability and complexity among the sexes and genders in a more rigorous and equitable fashion. What else is new? Well, science communication is new. Has anyone seen this video that came out from the World Economic Forum? This is unbelievable. So the World Economic Forum, I think, as scientists and researchers, being able to communicate the science in a way that's impactful to society is going to be making a difference about raising the visibility of sex and gender science. And this is a 1-minute video. I want you to watch it because you'll realize how quickly things are changing. Is that too loud? So how many of you produce videos like this? That's the emerging trend, to get societal buy-in into sex and gender science, talking about, did you see mechanisms? Did you see plain language? Did you see impact on society? Was it exciting? Did it call out the maybe not so good practices that we've been doing so far, and sort of get people excited about sex and gender science? So I think that one emerging trend is changing the way we communicate our science. Scientists in the ivory tower, I don't know if you have that in Australia, but certainly in Canada, we're moving to really, I would say, getting out there with the public. So that's another trend. We did also talk about moving away from the binary, and I wanted to say a few words about that. So, you know, people always talked about, oh, male testosterone, female estrogen. Is that true? Absolutely not, right? Throughout a person's lifespan, estrogens and testosterone will have different peaks. And then, of course, when you throw in folks who are taking gender-affirming hormones, then this is going to even shift that and shift the narrative. So looking at sex hormones rather than male and female is moving away from the binary. In fact, most sex and gender traits come in different shapes and sizes, and I think that that's why dichotomizing by sex sometimes can miss important mechanisms. And where we're moving to is considering sex as existing on a spectrum, the same way that gender identity and gender expressions have now been acknowledged as existing on a spectrum. But people do have a little bit more resistance from the sex perspective. So in your talk, I think maybe moving away from sex differences or sex binary language is going to be really, really important in addition to gender, because you are going to be the experts out there leading the conversation and bringing people along with you. Just to make it more complex, I was asked to speak about international trends, and I did warn you this was going to be kind of a 301 talk, but just to make it more complex, sex and gender don't exist in isolation. So now you've got spectrum thinking on multiple levels, because the society works on the body, like I said, and the body works on society. So how do we start combining sex and gender in the same analysis? How do we start understanding the sources of variability in disease by taking into consideration sex and gender? So this would be including genetics, it would be including hormones, it would be including anatomy or gender-related exposures, for instance, if we're looking at lung disease. And can we start designing studies that take all of those into consideration and collect the data and analyze it appropriately, kind of like complex multi-trait analysis in genomics? Instead of just looking at one factor, how do we move from that reductionist paradigm of science that was promoted during the 20th century, which was really, get rid of all the confounders, get rid of all the noise, females are too messy, we just need to study one thing at a time, to this is me. I'm complex. I'm messy. And you're going to have to find a way to study all of that together. So moving to this new complexity paradigm of the 21st century is something where I think sex and gender science can lead. And when I talk about gender-related exposures and lung disease, for instance, because of societal norms and trends, there are going to be preferential different exposures. For instance, if you're a miner, that mining is a big thing. I don't know if it's a big thing here in Australia. I should probably know that, yes. Should probably look that up. For pulmonary asbestosis or exposure to wood dust, asthma. Now, of course, gender norms and roles and occupations are changing, but the reality is that there's still differential exposure for women, for instance, being exposed to laundry and cleaning solutions, which can affect lungs and asthma. So this is what I mean by gender-related exposures, where you can't just say, oh, it's gender. You really need to break it down into the mechanism, but that sex differences or gender differences research may carve a path for you to figure out what those mechanisms might be. And then you might say, well, what about men's health, or what about women's health? Can you still apply a sex and gender lens to sex-specific conditions like menopause? Yes or no? Well, absolutely, because I don't know if anyone's gone through menopause here yet, and you don't have to raise your hand. Maybe that's a little bit too personal. But how come some women get hot flashes and other people don't? You can't just say, oh, look, sex, female, hot flashes. Yep. Female thing. Not at all, right? There's probably more variability in the way we experience menopause or menstruation cramps or periods than there is variability in other conditions. So how do we apply a sex and gender lens to this? Well, we could say, well, it's not just the sex hormones, because all postmenopausal women, by definition, that's the definition of menopause, right? Your estrogen levels get low and you no longer menstruate, and after a year, then we say that you've reached menopause, otherwise it's perimenopause. So what contributes to this heterogeneity? Is it biological? Is it this exon activation thing that maybe some of you are learning about for the first time today? Is there genetic variation in thermoregulatory phenotypes, which just means that we know that the hot flashes and sweats are due to problems with regulating your temperature, so that there's only kind of 1 degree of freedom for some women, but for other women, it's like before menopause. Is it because of familial risk? If this happened to your mom, then will it happen to you? Epigenetics, age at menopause. There's also surgical menopause and chemotherapy-induced menopause, and I had mentioned gender-affirming hormones that are taken, so all of this might play a role. Or is it social factors, sort of exposure to hormone-mimicking environmental substances or toxicants across the lifespan, exposure to chemicals, air quality, climate change, geographical location. So we can't just do sex differences research, obviously. We need to be looking at sex and gender factors no matter what we are looking at. All right, now on to the how. So what methods can actually be used to address some of these conceptual changes that are being introduced into research? Well, one, I would encourage you to appropriately operationalize and measure sex-related variables if you're doing basic science research or if you're looking at sex in humans. I should have said that. So that means including and reporting both sexes, but also thinking about the genetic, exon activation, and or hormone-related factors. What about androgen-related signaling pathways, both in females and males? Number two, if you're conducting research with human participants, then you also need to appropriately operationalize which aspects of gender are related to your research. Why didn't I mention gender in the animal and cell research? Because you are never going to refer to gender if you're working with non-humans until the animals can raise their hand and tell you their preferred pronouns, right? So if you are correcting manuscripts, gender is a social construct, and you see someone reporting the gender differences in the cell research or the animal research, then you are going to correct them and say, no, I think that's really the wrong term. You probably meant sex-related factors there. So again, because we're the experts, because we are going to be the Center for Sex and Gender Equity in Health, I think appropriate use of language is culture, right? Using the appropriate language is going to be really important for setting the stage. So if you're collecting data on your own, then it's a lot easier, of course, than if you're using secondary data, administrative data sets. So let's go with if you're actually able to collect data. Again, when I say different dimensions of gender, everyone thinks gender identity these days, and that's very important, but there's also other dimensions of gender that I've mentioned. So if you're interested in gender identity, then we're recommending, at least what's being recommended as standard best practice now, is a two-step question. And you may want to tweak the answers depending on the culture, and it is evolving quickly, but right now what has been accepted, at least in Canada, was to ask whenever you're collecting information from humans, what sex were you assigned at birth, meaning on your original birth certificate, and which best describes your current gender identity. You'll notice that we don't have trans there because I think everyone here knows, but just to make sure, cisgender is when the sex you were assigned at birth matches your current gender identity, and transgender is if the sex assigned at birth does not match your current gender identity, and of course there's genderqueer and a spectrum in between, but here from a research perspective, you can actually compare answers from the sex and gender, and that's a much more objective way of doing it than saying, are you a man or a trans man? Which actually, if you're a trans man, then you're a man. So why are you asking me if I'm trans? That defeats kind of the whole purpose unless you want to self-identify as such. So there's a lot of thought that went into this, and the references here, and I think my slides will be available after this for people who want to look that up. But gender identity is not the only component of gender, right? There's other dimensions of gender. You may want to look at gender relations. So what about gender violence in the home? What about experience with healthcare providers or the use of gender-inclusive language? If you want to measure that in your research hypothesis, then you're going to need scales and ways of measuring and collecting those variables. Or what about gender rules, either occupational exposures, gender of healthcare providers, household responsibilities, all of these could be risk factors. So when you look at gender roles, if it's interesting for your hypothesis about what you're studying, then make sure that you're collecting data on that. And finally, the concept of institutionalized gender, which is particularly important in global health research, where it's really the societal expectations of gender, the power differential in society, the gender wage gap, gender inequality, could you be using a gender inequality scale in the research that you're doing to actually capture those institutionalized or societal trends about gender? So this is the kind of approach that people are starting to use in terms of operationalizing gender. Now, you could also have a composite score where you measure different things and you put them together, or if you're doing administrative data, usually the variable is mislabeled as sex or gender. In fact, you might want to actually find out how the information was collected and not just assume that it's sex or gender or which aspect of gender it is. So I think that's, question number one. Hospital data sets are going to be very different than population surveys where people are allowed to self-report. But could a sex difference, if you find it, be explained by gender? So there are ways of doing this from a statistical and analytical perspective. So step number 3 in methods is focus on the mechanisms. How would you do that? Well, you might ask, is it the sex chromosomes, or is it the sex hormones that are playing a role in this observation that I have? Well, there's now a way to do that. It's called the 4-core genotype model, and you have an expert in the room. I'm sorry, Sabrine, but I'd like you to raise your hand. Sabrine has adopted this sort of novel technology of figuring this out, and you could go speak to her if you want to know exactly how to do it, but it is doable because there's someone in the room doing it. You may want to manipulate the sex hormones on their own. There's a lot of guidance on how to do this. A lot of people just don't know how to do it or what to look for. So there is going to be some capacity building, and this is a perfect project for your students to go around giving talks to the entire department if it's of interest. But I did say that I would stand up for the animals, and it's not just me who's standing up for the power differential with the animals. There is a worldwide movement to reduce the 3 R's, to reduce the use of animals, and quite frankly, humans sometimes, in research. So what does sex and gender science look like for new technologies? Has anyone worked with an organ on the chip yet? Or 3D printed organs? So we are now using stem cells to print organs, to put cells on a chip where you could test new drug candidates to look for toxicity. So this saves both humans and animals from being experimented on, and it's one way that governments are actually moving, and industry is moving, and academia will move in order to have novel developments. And yet, a 2017 analysis of 40 non-reproductive organ-on-a-chip technologies. So by the way, that could be liver, that could be your gastrointestinal tract, that could be your spleen. I mean, it's really incredible if you don't know about this. They reported that 62% did not specify sex, and that of those that did specify sex, they were predominantly male. So don't think that just because it's new and exciting, that it's not, that it's moving with the times. And I think this is really critical because we're going to say things like, oh, don't worry, we don't have to worry about male and female animals anymore. But it's going to be up to you to ask the questions about, oh, yeah, are you looking at, the organ on a chip from males and females, and are you taking sex and gender differences into account? So that's kind of interesting in terms of what's coming up. You might also want to ask how we should be accounting for sex and gender with other new technologies. So in silico models, again, these are new approach methods that are trying to get away from the use of animals in research. And so we use computer prediction models. We are also able to visualize molecules in 3D. Do you remember I was talking about the proteins and the sugars on the molecules? And now with the computer models, it's quite amazing if you don't know about this. It's really mind-blowing how they're actually going to interact. But if I just told you that their configurations may be a little bit different based on different exposures, then are we still studying a one-size-fits-all model? And is that something that we need to challenge early so that we don't make the same mistake? There's also in vitro bioengineering studies, biomaterial studies, the use of hydrogels. There's some cool research with hydrogels, which are kind of like balloons, I guess, that fill up with water that you could put cells on and grow cells on them in a matrix. Are we comparing the differences? So when you do that, you don't have to put in the cell culture. And cell culture, you might have something called phenol red, which is a pH indicator that you use sometimes, but it's actually a weak estrogen. Or you might be using bovine serum or human serum, which has sex hormones in it. So all these ways of, oh yeah, let's just do the research. Now that we're thinking about mechanisms, we need to take that into consideration, both in our new technologies and with the use of new technologies. And then finally, who could not talk about AI in this talk, right? So artificial intelligence. I had a work day before I came here because I'm still doing some stuff in Canada, and the deputy minister sent around a video. But this wasn't in my talk, but I'm just telling you about it because I watched this video this morning about artificial intelligence and security and how we're going to uptake it in Canada. And they did a survey in Canada, which I just learned about this morning, asking the Canadian population if they think that AI or artificial intelligence is going to change their life in their lifetime, and only 31% of people said yes, and our government thinks that that's a gross underestimate and shows just how few people realize how far AI has come already in all aspects of our life. So what does that have to do with sex and gender? Well, everything. Because this isn't to talk about AI, but there's different machine learning approaches, there's different generative AI approaches. It's actually quite fascinating. You should go and learn more about it, or we could give a talk about sex, gender, and AI one day. But the way the artificial intelligence works is it learns from the data that it's given. So you could imagine that if it's not given representative data, then it's not spewing out answers that are going to capture the whole population and their needs. So one example, for instance, in medicine is the use of artificial intelligence to diagnose, let's say, pneumonia from chest x-rays, right? So this is, you don't really need a lot of warmth and fuzziness, I guess, like the person part of looking at an x-ray and reporting what you see is very different than if you're having a, let's say, physician-patient interaction. So very objective. You would think that a computer or AI system would be able to help with this. But of course, if you don't feed in enough x-rays from a diverse population, if, for instance, you go to a hospital with all white folk or something like that, then you're not going to capture the full spectrum of different anatomical variabilities, and you will end up underdiagnosing certain populations. So this, in a way, is a little bit, and we're going to move into intersectionality soon, it's a little bit about who makes the decisions about which data, train the algorithm that then gets used and marketed, and how does it really benefit everybody. So the fourth step is ensure there's appropriate sample size, and I know Mark's going to be talking a little bit more about that. So one of the things that I mentioned earlier was there's lots of ways you could do an analysis. Obviously, the best way is to look for effect modification and interaction by sex if you are powered to be able to do that. You can also detect main effects within sex strata, but you may not be able to report a sex difference if you weren't powered to actually look for differences. And of course, you could disaggregate by sex. And the key here is to be cautious with your interpretation of what you find. And I know we're going to be talking a little bit about that later in the day. But this was one of the criticisms in that that issue of Cell that I told you about last week or the week before, where they were saying, oh, folks are just saying do a factorial design, but then for those of you who read statistics, you'll see the pink-purple boxes are the females, and there was no statistical effect, even though there was a main effect, and then they reported over there that the men were. But look at the variability in the placebo, for instance, in that light pink box over there. It could just be that the females had more variability, and if it wasn't powered, then you're not going to detect a statistical difference. So this is where it can get confusing for folks if they don't understand what they're reporting, why they're reporting, how they're reporting, and what they need to do better. So this is a big red flag. Same thing in human studies. Here, for instance, in the red box, just to show, you know, they did well. They certainly disaggregated by sex. But then they reported, oh, look, there was no effect in men because it crosses the line and you get into a negative, for those of you who don't know confidence intervals. So can we say that this wasn't effective in men? Well, it turns out there weren't a lot of men in this study. I know because I did it. And so you can't really start saying that there was a difference. It's still helpful to look at the magnitude of effect and how much variability there was, because ultimately, the goal isn't to detect sex differences, but if a man walked into see a physician about cancer, well, he's going to want to know which of the two treatments are better for me. I'm not sure he cares if the treatment was different in women. I think he wants to actually look at, well, what's the probability of me getting better if I take this treatment or that treatment? So I think that this intra-group analysis is just as, if not more important. Well, it's just different. It serves a different purpose than looking at sex differences. So my last word about this is if we are going to be gender inclusive, then there are going to be small sample sizes, right? In every population survey, you might not find enough trans folk to be able to do statistical analysis. Or if you're looking at the autoimmune diseases that I talked about earlier, there are going to be more women. So what do you do about this? Well, if possible, if it's relevant, if you're looking at this, if it's important in those folk, if you want answers that represent them, then you're going to have to oversample the underrepresented subgroup. And you may have to spend time building relationships with that community in order to recruit them in. You may not be able to make you may not able to say it's statistically significant or not to draw conclusions about it, but you will be able to report it as raw data so that it can be included in a meta-analysis. In Canada, we have a problem with small numbers because there's actually a government rule that if you have less than 5 people in a box, then there's a risk of being able to identify them. But sometimes I do wonder if the folks who gave their data would rather take that risk than be erased from the analysis. And so why we're collecting the data and then not using it is there's a fundamental ethical issue with that, and I know that a lot of stuff was well-intentioned, excluding females from research was well-intentioned because we didn't want pregnant women to be exposed to toxicity, but sick women get pregnant and pregnant women get sick, so how did that work out, right? But seriously, so questioning the why and questioning the standards, I think, is going to be part of our foray and what the center, you as leaders in the center, are going to be able to promote. All right, anyone learn anything yet? All right, now I'm going to talk a little bit about intersectionality and how to think through an intersectional lens. So why is it important? Well, it explains the worst health outcomes. In Canada, if we look at population data, we know that there are significant health inequalities among Indigenous people, among sexual and racial minorities, for recent immigrants, for people living with functional limitations, and there's also a gradient of inequality by socioeconomic indicators. So if these are the folk who are experiencing the worst health outcomes, then shouldn't we be recentering our research from an equity perspective to bring them up to the mean or further? So this will give us, in a way, the most bang for our buck when we look at social justice, quite frankly, which is what intersectionality is about. So your first question is going to be, which intersections of power and privilege are of interest to the research topic, area, subject that you want to make a difference in? And I think it's going to be really important to identify the forms of discrimination. Here, for instance, I put ableism and xenophobia that may be working on the variables that lead to these poor outcomes. Now, critical intersectional research must, and I'm going to repeat this because it's super important, be rooted in the objective of achieving social justice. If you're doing your research just to get a good publication, then you're not actually conforming to the principles of intersectionality, and I just want to say that as strongly as possible. You have to recognize power and that intersectionality is always political. So this is about changing systems. Have to acknowledge the origins of intersectionality in Black feminist scholarship, so I would invite you to actually cite or reference the term when you use it, and meaningfully engage with this intellectual work and its ongoing debates. There's quite a lot of debate about people misusing the term intersectionality right now that some of you may be aware of. And consider how categories or forms of discrimination can change across time and place, and how meaning can vary for individuals belonging to a category depending when and where they are, right, in time and history and geographic location, so that what you're reporting from your country may not be the same in other countries, and that's important to acknowledge. And so you should be accounting for all the contexts that shape that. All right, so how do you do intersectional research? And you'll see that there's resources that I've put up on a slide, but very important to the design of intersectional analyses versus the analysis of intersectional research. So once you've decided which intersections should be the focus of research, validate that, right? In fact, you should be having representative voices from the community on the design team before you think it's important. We should find out from folks who are experiencing the worst health outcomes which intersections they think are most important, because without lived experience, it's just scholarly analysis, and that is not going to be as powerful in intersectional research as hearing from people with lived experience. 2, design a sampling strategy that will avoid underpowered analyses. So you may want to include stratified sampling with oversampling of groups at the intersections of interest from the start of your research, and make sure that you apply for funding for that. 3, consider multidimensionality. So I talked about the different dimensions of race. Well, there's also different dimensions of, I talked about the different dimensions of gender. There's also different dimensions of race. There's colorism, there's different castes depending where you are. There's a whole, I would say, research area just on intersectionality within racial categories. And same with sexual orientation. So how are you going to measure them? And are you just reading from a paper about the best way to measure them? Or today I told you what's working in Canada for measuring sex and gender. You need to actually explore this with the communities that are going to be participating and hopefully co-designing the research with you, so that you appropriately capture what's relevant. And finally, how are you going to analyze the data? Well, you need to analyze the data in ways that make the outcome and effects clear at different intersections. So it's not just being additive. There are some statistical techniques, but I do want to share some wisdom from Harlan Pruden, who asked me, like, well, who are you comparing us to, and why are you comparing us to them? And so he said to me, so I learned statistics, and do you always make the white male 0? And are we always comparing everyone to the white male? Like, why are you doing that? And why does that have to be the default? And, you know, he also asked, and isn't statistics based kind of on the mean and the 95% kind of distribution, and what's normal and what's not normal? Well, I could tell you, I'm an Indigenous Two-Spirit. Actually, I think I have his picture. There's Harlan. You know, I'm an Indigenous Two-Spirit individual. I could tell you that I am always outside of the 95% distribution here, being Indigenous and Two-Spirit. And Two-Spirit is a community organizing LGBT categorization that we use in Canada, for those of you who don't know. So you haven't even heard of it, right? So how do you use health equity approaches to recenter the margins in the statistics that were invented by folks who were really just looking, you know, to compare things to the norm and being in the normal distribution? So that's kind of interesting, because Harlan's brilliant. He's not an elder yet, but I think he will be. And he kind of said, so you folk are always doing these intercategorical analyses where, you know, I'm never going to be white. Like, what's the point of comparing me to the white man? And not only that, but you're kind of perpetuating racism by always announcing the news and the reports from the studies. Oh yeah, Indigenous folks have four times more diabetes than white people. Or, you know, we're dying twice as quickly from opioid overdoses. Do you think that's really helping counter negative perceptions about Indigenous people? So is the way you're actually reporting and analyzing your research contributing to discrimination in society, rather than, as you probably told me, Cara, like when I first asked you, because I've learned a lot, and I'm telling you this with humility from my experience, kind of working through an intersectional lens, about how what we consider standards, well, that's what intersectionality is about, because these were the methods that we were taught from people who made the decisions at the time. So what Harlan recommends for an equity science approach is to do more intracategorical comparisons. So why would one Indigenous community have more diabetes than another Indigenous community in Canada? And what could we learn from comparing those two groups? The same way I talked about sex-specific analyses of hot flashes and menopause. Are we doing too many intercategorical comparisons? And maybe that's not the way to go when you're doing intersectional research. The other flaw that occurs when you do an intersectional analysis is that, like I said, folks think that, remember that intersection analogy, the explanation I gave you at the beginning, that you just take the result for Black people and you take the result for for women, and then it's additive what the effect might be for the outcome for Black women. Well, no, there's an interaction, and that interaction needs to be accounted for. And that's what I mean when I say that we need to allow each intersection of interest to have its own outcomes and effects. But it's also important to acknowledge the heterogeneity. So the way you report it, don't let it contribute to more stigma about a group, like I just gave you the example from Harlan. Here's AI again, and this was a really interesting example that many of you are probably familiar with, that showed that when you used AI to capture images, there was misrepresentation and error rates that were, a third higher, so 35% for dark-skinned women, 12% for dark-skinned men, 7% for light-skinned women, and less than 1%, of course, for lighter-skinned men, because there were more images introduced, so that the algorithm was trained on data that represented mostly white men. So this is a simple example, but it shows how the intersectional biases get embedded in methods that then become technologies that then get used by everyone, by Google, around the globe. I think we're nearing the end and you're probably getting tired and we should take questions, but just to let you know that there are some more sophisticated methods out there for intersectional analyses, and these methods are evolving. I think it's like, when I was head of the Institute of Gender and Health, when I started, we talked about the LGBT community, then we talked about the LGBTQI community, then we talked about the LGBTQI2S community, and then it changed to 2S LGBT, all in the span of 8 years. And somebody said to me, like that alphabet confusion, how do I deal with this? Like, how do you expect us to actually make methods if it's always changing? And somebody might say the same about intersectionality, but the answer that I received, which I want to share with you, is it just means that we're making progress. Okay, so I wouldn't be too scared if we haven't landed on the final paradigm shift yet. We're in an evolution phase where it's important to engage and work through this together. The same with intersectional analyses. So you could certainly look for interaction, and I think that's the place to start, looking for an interaction between the variables of interest. If you're looking for direct effects, but people are more frequently recommending now a mediation decomposition, which might ask sort of, well, what was the effect of discrimination on the outcome for this group versus that group? So it's a little bit different. And Mark, I know that you will be talking about this afternoon, no, possibly, but you could ask Mark about it. All right, so I'm gonna end here, just putting up a slide with resources for those of you from TGI, the George Institute, who do global health research. Of all these resources, I want you to notice the one over there that was put out by the WHO that I had the privilege of participating in, and it's incorporating intersectional gender analysis into research of infectious diseases of poverty, but it really goes through the different co-design phases of an intersectional analysis if you're working in a different country, so I highly recommend that. And because I always like a call to action for intersectionality, and if I didn't already, which I might have forgotten, I do want to acknowledge with humility that I'm speaking about this from a scholarly perspective, intersectionality. I acknowledge that I was brought up with white privilege and that I don't have lived experience, so I am trying to give credit to folks who have advanced this, and I expect that you will do the same. But for now, start thinking about social processes and systems of power. If you don't have the lived experience, then please ensure that members of your team do, or even more importantly, engage with communities. Keep abreast of the evolving measurement tools and resources, And look outside of biomedical research. I'm just going to say that we're not always the most innovative, and probably the social sciences and human rights areas are a lot more advanced than we are in health and medicine. So I do also want to say that. In fact, I brought in the work of Kimberly Crenshaw, who was a legal scholar who started advancing this. So where do you fit in? And I'm going to end with this. If you're here, then you're probably a leader and are going to be growing the science. And there's probably about 5% of the researchers in the world who are going to be working to advance sex and gender science. So you're growing the science, you're the leaders, you're the innovators. But we still have to bring along the other 95% of researchers and workers who aren't quite where we are and who need to be mainstreamed. So I think that being an inspirational role model, finding the right words to introduce emerging trends while also making sure that they understand the basic difference between sex and gender, for instance, and that gender is multidimensional, is going to be where you fit in. If you're here, it's because you care and you're going to be a champion for this. So I think that over the next 2 days, I would invite you to reflect on your role, not only for advancing your own research, but also for bringing the rest of your department, your world, your hospital, your faculty along with you, the public, and that's what we're going to be talking about as the days go on, recognizing, of course, that science is always evolving, which is beautiful, but a lot of people like consistency, and so that might be a challenge to move them along with you. So finally, in conclusion, I invite you to be bold and push the boundaries, to be the leaders others will follow, to be the change that you want to see, and so that the next generation of sex and gender science grows and can be led by you. That's it. Thank you. And we're open for comments and questions. Yeah, please introduce yourself.
Hi there, thank you. What a great way to start the day. I'm Francisco Lopez. I work at ACON's Pride Inclusion programs and work with a lot of...
Sorry, not everyone knows what ACORN is.
ACON. ACON is New South Wales LGBTQ health organisation, but our Pride Inclusion programs work nationally with mostly health services. I mean, we work with corporates as well around inclusive practices for staff, for patients.
Perfect.
But we haven't done a lot of work with researchers, so this is really exciting, and I think everyone here, will be leaders in this space, so that's fantastic. So for me, it was more a comment that I love the notion of breaking down, not just, obviously for some people it's about differentiating between sex and gender, but then breaking down and talking about specific characteristics, specific gender roles, gender concepts within society. I think that's fantastic. And I think the other thing I just wanted to comment was, absolutely, if we do start looking at minority groups, so for example, trans and gender diverse folk, involving them in the design of studies, but also thinking about them when we're not including them as well. So for example, that beautiful video that showed an actual mechanism of disease, thinking about, okay, who are we not talking about here when we say men and women? And can we at least acknowledge that in our current practices as well? So even looking at language within your current practices, I think can go a long way as well in starting to invite people in.
Thank you. Yes, language.
Wonderful start.
Language is culture, and I will obviously, because I'm up here, just mention that it's tricky, the language in society right now, and we live in countries that are using that language. For instance, I've been working with Health Canada, our government, to get the world to change their international standards for even including the word gender, and there are some countries in the world, as you well know, who don't even want to include the word gender yet. So it's a very, very, very good comment, and I think there just has to be sensitivity about when you push, when there's small steps, when there's big steps. I guess the World Economic Forum decided to go with men and women, but your point is very well taken.
And a wonderful thing in Australia, the RA standards around sex and gender.
Oh, wonderful.
So the ABS have them published online. So similar to what you presented around that two-step approach to asking about sex and gender, we have standards here in Australia published by the ABS.
That's wonderful. And I do know that JAMA, if it hasn't yet, and I don't think it did, but I've seen them, is releasing new guidance. So that's the Journal of the American Medical Association, which is one of the big, healthcare journals. New guidance around language. So anyone internationally who wants to publish needs to be using that language. Yeah. Just introduce yourself, please. Wait, we'll get you a mic. We want everybody to hear you. Thanks.
My name's Sue Howe. George Institute.
A little closer.
Just a question continuing on definitions, because I noticed that in your two-step approach for sex and gender, still the sex is binary. So is that something that you're thinking needs to change by putting in intersex there as well?
So I think that most people were assigned a sex at birth. There are a few people, I think, who were assigned intersex at birth, but it's a really good point. And now that we're raising awareness around it, I don't know if there was an other there, but it's a good point.
Hi, God, that was loud, sorry. I'm Nisrana from the Monash Biomedicine Discovery Institute. That was amazing, thank you so much. I was on the deliberative panel last year that AMRI organised, the Association of Australian Medical Research Institutes. And one of the things we looked at for that was a prerequisite for considering sex and gender was required to ensure quality research. So like ethics committees is one part of that. And we talked a lot about where you might situate. Would you do it through an ethics committee or something like that? And I guess for me, I'm just wondering, have you, is this a focus that was done in Canada but also in the USA? And B, because I work with a lot of biomedical researchers who unfortunately are not that keen to focus on this, is there any evidence of new and more accurate research findings impacting on healthcare therapeutics? So, in terms of finding new therapeutics that have been impacted thanks to the better consideration of sex and gender?
Great question. So I'm only going to speak for Canada, and I'm proud about that. But so I attended, what was it? It was the CAREB, I don't know what that stands for, Canadian Research Ethics Boards Association or something like that. This was probably right at the beginning, probably almost 10 years ago, where myself and the president of the Canadian Association of Research Ethics Boards got up and had a debate, and the conclusion was that it is just not ethical to be doing research that doesn't benefit everybody. So we looked to introduce that into some of the training that research ethics boards have to take. Unfortunately, there's been a delay with that, but for instance, if that's what you do, I don't know if you have like the standard, like we have the Tri-Council policy that everyone on a research ethics board has to take to be accredited. So the emerging trend is to make sure there's a chapter on this, and of course, each ethics organization would have to write it. So, I think it would be a huge deliverable of your attendance here if you introduced that idea and delivered it for all the ethics boards across Australia. So the answer to that is yes. There are certainly different checkpoints at the funding phase, at the ethics approval phase, at the university approval phase, at the reporting phase, and then getting into clinical practice guidelines, because if the research is benefiting everyone, then even clinical practice guidelines should probably not have a one-size-fits-all approach for how we should be treating people. So in terms of the second part of your question, is there evidence that some of this research has led to different care pathways? The answer is yes. Certainly in Canada, and I don't know if in Australia, but raising awareness around different heart disease symptoms for women. So women's heart disease has been missed because they don't have the typical crushing chest pain that men do. They present more with fatigue and shortness of breath, and women's heart disease has been missed. So raising awareness can lead to better outcomes. There was a study out of Cleveland Clinic which actually cut the mortality rates for women experiencing heart disease in half, because they looked at gender bias in the treatment pathways. So because it took longer to diagnose, the women didn't get sent to the cath lab as quickly, and then when they did, they actually tried to put in the IV through the neck or the arm, which is harder because of anatomy, so then they changed the protocol to just insert it via the leg. There's all these things where, I'm not gonna go into detail, but they were able to cut the mortality for women from heart disease in half. That's one example. You asked about therapeutics. There are medications on the market where there's different doses recommended for men and women right now. In fact, there was a fascinating study. I might be running out of time, though. Maybe I'll just stop here because it's already 11:50. Well, I could go on and on. Yes, so there are different doses recommended based on the fact that women are not just small men, and that we, have different fat tissue and metabolism, and maybe we don't need as high a dose. So yes, there have been recommendations, and I could talk to you afterwards. Sorry, Robyn. It's just such great questions.
No, look, I'm sure there's more questions. Oh, okay, Claire, no, Bridget, we've got two. Okay. We're flexible. Claire, Bridget.
This is your break, but yeah.
Okay, I'm going to jump up. Claire Arnott from the George Institute. Thank you so much. I learned a great deal. One thing I thought was very powerful is you spoke about how we need to make sure our research doesn't perpetuate discrimination and racism. If we are reporting on 4 times the rates of, myocardial infarctions in First Nations women. But I also know that data is very powerful, and we often use it to advocate for services and funding and resourcing for people who most need it. And so I'm just wondering how you manage those tensions in the work that you do so that you're not perpetuating discrimination, but you're giving the appropriate attention and resources to those who need it.
Great question, and we do debate that, and I would just say that usually, I'm just going to say this, it's usually, I don't know where you work, but it's usually a white person in government who asks that question. So I think that, do we have to report it, or is it just a matter of showing it to the authorities who are making the decisions? I also think that, nothing about us without us is something that Indigenous populations in Canada say. So if you're using data about them, then I think they need to give approval to how that data is going to be shown to the authorities. So I don't have an answer for you, and it does seem a little intuitive, I think also in Canada, and I'm not proud to say this, although I did just read in the news this morning or see something, like I said, I had a whole work day before I came here, about, Indigenous folks now need to be included in decisions about mining and oil production on their land as part of the governing board of directors, and that's very different. So just, again, who's deciding how to report that data? Should anything be reported without their input? We do have policies about ownership, control, access, and privacy, so that no Indigenous, we say Indigenous because there's First Nations, Métis, and Inuit in Canada, so it's a grouping, but no data should be used without the authority to control who it's shown to and how it's shown to other people. So just being in the news or the media, I don't think is helping, but of course showing it to the people who make the decisions, but hopefully they'll be Indigenous folk. And I know you had a thing here about Indigenous people having authority to control stuff, so maybe that's a sensitive topic, but that's really the right answer, I think.
Hi, I'm Bridget Hare from the School of Population Health, and thank you for a fantastic talk. I really loved it. But what I actually want to respond to was a point that came up over here about recording sex as more than a binary. I work a lot with Intersex Human Rights Australia, and it's important for people in this room to understand that intersex people don't want to have a third option in the sex category. What Intersex Human Rights Australia is advocating for is an extra question around people who are born with variations of sex characteristics, partly because sometimes people aren't born with, sometimes things aren't actually reported at birth, they're determined later on. And so that's why the Australian Bureau of Statistics standard is the way that it is, that you have the 3 questions: the sex, the gender, and the variations of sex characteristics. And we're currently advocating very, very hard to get that in the census. That may or may not happen at this point. But please don't go out of this room advocating for having sex as being more than binary. And currently, there hasn't been an option for it to be more than binary for anybody who is an adult. I think in some jurisdictions now in Australia there is an other category, but that is not being supported by the intersex community organisations at this point.
Thank you. Thank you for sharing that. I wasn't aware, and that actually sounds very promising. And no, I don't think anyone wants to be considered other. I think that's a really, really good point. So that is a great way to end this. Back over to you, Robyn, and thank you very much. And let's continue the conversation.
A huge amount of food for thought in your presentation, Cara. Just, I could comment on lots of things and ask lots of questions, and I'm sure other people feel the same. So the good news is Cara's going to be here for the 2 days. Cara's leading the strategy session that we've got tomorrow afternoon when we explore where we want to go from here. And I'm also thrilled to say we're in discussions with Cara about spending her sabbatical in Australia over the next 12 to 18 months, where she'll spend some time in Victoria with the team at Deakin and some time here in Sydney with the teams at the George Institute and the Australian Human Rights Institute. So a fantastic resource, and I think key thing for me I just want to reiterate is, look, you know, we're not going to get it right all the time, and we shouldn't criticise each other. It's how do we learn and move forward, because we in the room are about the leaders, as you say, and so we've got to support each other and know that the language is going to change over time. So, yeah, thank you so much. Really fantastic, Cara.